Good day everyone, I am Jamaica Mayagudo. I am going to discuss to you the different cardiovascular disorder and the root words pertaining to the blood vessel. The cardiovascular system consists of the heart, blood vessels, and blood. Its primary function is to transport nutrients and oxygen-rich blood to all parts of the body and to carry the oxygenated blood back to the lungs. Heart. The heart is an organ about the size of your fist that pumps blood through your body. It is made up of multiple layers of tissue. Your heart is at the center of the circulatory system. Aortic aneurysm. An aneurysm is a weak or expanded part of an artery. Like a bulge in a balloon, your arteries are large blood vessels that carry oxygenated blood from your heart to other parts of your body. If an area in an artery wall weakens, the force of the blood pumping through can result in a bulge or aneurysm. Aneurysm usually aren't painful. You might not know you have one unless it ruptures or bursts. If it does, it can be very dangerous or even fatal. Dissecting aneurysm. An aortic dissection is a serious condition in which a tear occurs in the inner layer of the body main artery or the aorta. Blood rushes through the tear, causing the inner and the middle layers of the aorta to split or dissect. If the blood goes through the outside aortic wall, aortic dissection is often deadly. A thoracic aortic aneurysm occurs when a weak spot in the wall of the aorta begins to bulge as shown in the image. Having an aneurysm increases the risk of rupture or a tear in the aorta's lining or dissection. Angina. Angina, also as known angina pectoris, is a chest pain or pressure usually caused by insufficient blood flow to the heart muscle. It is the most commonly symptom of coronary artery disease. Angina is typically the result of partial obstruction or spasm of the arteries that supply blood to the heart muscle. Other causes of angina include abnormal heart rhythms, heart failure, and less commonly, anemia. The term derives from the Latin angre, means to struggle, and pectus means chest, and can be therefore be translated as a struggling feeling in the chest.
So good day everyone. So first I'm going to discuss the cerebrovascular disease. So what is cerebrovascular disease? So cerebrovascular disease is an umbrella term for conditions that impact the blood vessels in your brain. Cerebral refers to your brain and vascular refers to your blood vessels or arteries and veins. Cerebrovascular disease may cause a reduction of blood flow to your brain, ischemia or bleeding hemorrhage in a part of your brain. Both conditions are generally referred to as a stroke. Blood vessel diseases in the brain can lead to strokes as well as many other vascular conditions. So let us now proceed to arteriosclerosis. So arteriosclerosis means hardening of the arteries. It is a general medical term that refers to your normally flexible artery walls becoming hard or stiff. Your arteries are blood vessels that deliver oxygen-rich blood from your heart to all the organs and tissues in your body. Hardening of your arteries can interfere with blood flow and disrupt the normal workings of your circulatory system. Arteriosclerosis is a gradual process that occurs over many years. It can be dangerous because it develops silently. You may have no symptoms for a long time until the hardening of your arteries leads to complications. Arteriosclerosis raises the risk for a wide range of cardiovascular diseases, conditions affecting your heart and blood vessels. So arteriosclerosis is when plaque, a sticky substance made of cholesterol, fat, calcium, and other materials builds up inside the walls of your arteries. Arteries are the blood vessels that carry blood from your heart throughout your body. Arteriosclerosis can put blood flow that risks as your arteries become blocked, and it can cause clots to form It's the usual cause of heart attacks, strokes, and peripheral artery disease or PAD, which together are called cardiovascular disease. The condition doesn't just affect blood vessels in your heart, it can happen in any of your body's arteries. So, let us proceed to dyslipidemia. So, dyslipidemia refers to unhealthy levels of one or more kinds of lipid or fat in your blood. Your blood contains three main types of lipid. First one is high-density lipoprotein, HDL, and the second one is low-density lipoprotein, LDL. And the third one is triglycerides. If you have this lipidemia, it usually means your LDL levels or your triglycerides are too high. It can also means your HDL levels are too low. LDL cholesterol is considered the bad type of cholesterol. That's because it can build up the form clumps of the plaques in the walls of your arteries. Too much plaque in the arteries of your heart can cause a heart attack. HDL is the good cholesterol because it helps remove LDL from your blood. So, let us now proceed to myocardial infarction or MI, also known as the heart attack. Heart attack is caused by decreased or complete cessation of blood flow to a portion. The myocardium, myocardial infarction may be silent and go undetected, or it could be a catastrophic event leading to hemodynamic deterioration and sudden death.
So let us now proceed to infarct. An area of localized tissue necrosis death resulting from a blockage or a narrowing of the artery that supplies the area. Infarctions occur in organs like heart and brain, as well as other parts of the body where there is a failure of blood supplies or blockage leading to tissue death. Ischemia. Local deficiency of blood supplies caused by circulatory obstruction, root hemo. Ischemia, also known as ischemia, is a condition characterized by a lack of blood supplies to a tissue, muscle group, or other organ in the body. This results in a shortage of oxygen necessary for cellular metabolism to sustain tissue life. It can be a condition such as atherosclerosis. Lastly, CRP, also known as C-reactive protein, is a protein produced during systematic inflammation, which may contribute to atherosclerosis. Also, high CRP level can indicate cardiovascular disease and prognosis. What does it mean if your CRP is high? High level of CRP mean you have a serious heart condition that causes inflammation. Inflammation is your body's way of protecting your tissues and helping them heal from an injury, infections, or other disease. How does CRP relate to cardiovascular disease? Your level of CRP can be indicator of how risk you are for developing cardiovascular problems. This is because the development of atherosclerosis, laying down of cholesterol inside the blood vessel walls, is associated with inflammation within the vessel wall. That's all.
An embolism is a sudden blockage of a blood vessels by embolus, which is typically a blood clot, air bubble, fluid droplet, or other foreign materials. These blockages disrupt blood flow, potentially causing damage to tissue and organs supplied by the affected blood vessels. Depending the location, embolism can lead to various health problems, such as strokes when they occur in the brain or pulmonary embolism when they affect the lungs. A thrombus is a blood clot that forms within a blood vessels and can obstruct the flow of blood. It is typically formed in response to injury and inflammation in the blood vessels and can lead to serious health complications. It becomes dislodged and travels to other parts of the body. Thrombus formation can be caused by factors such as immobility, surgery, or certain medical condition.
C-reactive protein produced during the systemic inflammation, which might contribute to atherosclerosis. High CRP level can indicate cardiovascular disease and its prognosis. Your level of C-reactive protein can be an indicator of how at risk you are for developing cardiovascular problems. This is because the development of the atherosclerosis, laying down of the cholesterol inside the blood vessels wall, is associated with the inflammation within the vessel walls. The result is higher level of CRP in the patient within the atherosclerosis than its those without atherosclerosis. The value of knowing CRP level depends on whether you fall into one of three cardiovascular risk groups. Low risk because of low cholesterol level and little history of risk factors, that is, no diabetes, high blood pressure, or smoking, and no family history of heart attack at an early age. Even a higher level of CRP will probably not put you at a level at risk that requires then lifestyle change. To intermediate risks, helpful to know CRP levels because it can provide missing pieces of information for physician in deciding next step in the treatment. High risk, not essential to know your CRP because you should already be combining aggressive treatment with the lifestyle change to lower your risk. Coarctation of the aorta, localized narrowing of the aorta with the restriction of the blood flow. Blood flow through the heart. The heart pumps blood to all parts of the body. Body provide oxygen and nutrients to the body and remove carbon dioxide and waste. As the blood travels through the body, oxygen is used up and the body becomes oxygen poor. Oxygen poor blood returns from the body to the heart through the SVC, superior vena cava, and IVC, inferior vena cava, the two main veins that bring back to the heart. The oxygen poor blood entered the RA, right atrium, or the right upper chamber of the heart. From there, the blood flow through the TV, tricuspid valve, into the RV, right ventricle, or the right lower chamber of the heart. The RV, right ventricle, pumps oxygen poor blood and through the PV, pulmonary valve, into the main pulmonary artery (MPA). From there, the blood flows through the right and left pulmonary arteries into the lungs. In the lungs, oxygen is put into the blood and carbon dioxide is taken out of the blood during the process of the breathing. After the blood gets oxygen in the lungs, it is called oxygen-rich blood. Oxygen-rich blood flow from the lungs back into the left atrium (LA) or the left upper chamber of the heart through the pulmonary vein. Oxygen-rich from the flow through the mitral valves (MV) in the left atrial (LV) or the left lower chamber. The left ventricle pumps that oxygen rich from through the aortic valve into the aorta. the main artery that takes oxygen rich from out to the rest of the body. Hemorrhoid, a varicose vein in the rectum. Internal and external hemorrhoid can be bleed if they are not cared of properly. In some cases, thrombosed hemorrhoid can be also burst if they become too full. It is essential to learn why hemorrhoids bleed and what you can do to seek relief from the pain and discomfort and bleeding they can cause. From some people, hemorrhoids do not cause any symptoms or pain, but for others, they can cause itchy, bleeding, and sensation of burning and discomfort that can be pretty. A bleeding hemorrhoid is usually a sign of the irritation or damage to the wall of hemorrhoids. It should resolve on its own over time, but you need to self-care and treatment to the speed up the recovery process to the discomfort and prevent it from returning. Both internal and external hemorrhoid can turn into the thrombosed hemorrhoid. It means that a blood clot from the inside the vein. Thrombosed hemorrhoids are not dangerous but can cause severe pain and inflammation that can affect normal activity.
Patent ductus arteriosus, persistence of the ductus arteriosus after birth. This is a vessel that connects the pulmonary artery to the descending aorta in the fetus to bypass the lungs. Dyspnea, difficult or labored breathing. Rheumatic heart disease, damage to heart valves after infection with a type of Streptococcus. The antibodies produced in response to the infection produce valvular scarring, usually involving the mitral valve. Edema, swelling of body tissues caused by the presence of excess fluid. Causes include disturbances, kidney failure, inflammation, and malnutrition. Stenosis, constriction or narrowing of an opening. Cyanosis, blue fingernails due to lack of oxygen in blood. It is a bluish discoloration of the skin caused by lack of oxygen.
Hi guys, I am Trisha Ann Peralta Adatu and I am going to tackle some disorders of the cardios. First is the heart failures. So, what is heart failures? Heart failures is a condition caused by an inability of the heart to maintain adequate blood. It is a condition that develops when your heart doesn't pump enough blood for your body's need. This can happen if your heart can fill up with enough blood. It can also happen when your heart is too weak to pump properly. Next is hypertension, or we also know it as high blood pressure. It is a blood pressure that is higher than normal, which is the normal blood pressure is 130/70. Tachycardia. Tachycardia is an abnormally rapid heart rate, usually over 100 beat per minute. So, ito naman yung kabaliktaran ng bradycardia. If bradycardia is lower than 60 beat per minute, ang tachycardia naman is 100 beat per minute. Next, bradycardia. What is bradycardia? Bradycardia is a slow heart rate of less than 60 beat per minute. What is the normal heart rate of an individual? The normal heart rate of an individual is 60 to 100 beat per minute. If the heart rate is lower than 60 beat per minute for an adult, it is considered as bradycardia.
Thrombophlebitis, inflammation of a vein associated with formation of a blood clot.
Thrombus means blood clot and itis means inflammation. Blood clot may form when something slows or changes the flow of blood in the veins. Mostly, it occurs on your legs and pelvis, but also occurs in arms. Phlebitis, also sometimes known as superficial vein thrombosis or superficial thrombophlebitis. Phlebitis is the inflammation of a vein, and its common causes are injury or irritation in the lining of the blood vessel, or a blood clot inside the vein. In the case of superficial phlebitis, is the placement of an IV catheter or the IV insertion. A twisted and swollen vein resulting from breakdown of the valves, pooling of blood and chronic dilation of the blood vessel. Root word varico, also called varix or varicosity. Varicose veins, common condition caused by weak or damaged vein walls and valves. It is caused by increased blood pressure in the veins, and commonly affect the veins in the legs. That's because standing and walking increase the pressure in the veins of the lower body. Diaphoresis, profuse sweating or excessive sweating, commonly associated with an underlying medical conditions that alter hormone levels of the body. Hyperthyroidism, an overactive thyroid or speeds up the body's metabolism. Another, diabetes mellitus, a metabolic disease involving inappropriately elevated blood glucose levels. Endocrine tumor, formed in glands or in cells that produce hormones. And those who are going through menopause and pregnancy can experience diaphoresis. Occlusion, a closing off or obstruction as of a vessel. Occlusion can also reduce or even stop the flow of oxygen-rich blood to downstream vital tissues like heart, brain, or extremities. Shock, circulatory failure resulting in an inadequate blood supply to the tissues. For example, cardiogenic shock. Syncope, a temporary loss of consciousness caused by inadequate blood flow to the brain, fainting or passing out.